In the second section of our lecture, now we will talk about acute sinusitis. There are, as I mentioned in the previous section, 4 paranasal sinuses. So in this section, we will talk about the acute inflammation of all these 4 paranasal sinuses, in which we will talk about the acute infection of maxillary sinus leading to maxillary sinusitis, sphenoid sinus, ethmoid sinus, and also we will talk about the frontal sinus and acute infection of frontal sinus. So this is the main topic which we will discuss in this second section of our lecture. So first, the acute maxillary sinusitis. Maxillary sinus is the most commonly affected sinus in acute infections, and from there the infection spreads to the other sinuses like frontal, ethmoid, and sphenoid sinus. So acute maxillary sinusitis, here the causes of acute maxillary sinusitis is the usually recurrent infections. If the predisposing factors like recurrent infections are present, if the infections persist, or if they occur again and again, then the most common cause of maxillary sinusitis is that recurrent infections. Viral rhinitis spreading to mucosa. Again, we mentioned in the previous slide that the previous section that the most common etiological factor of sinusitis is the viral infection. So whenever there is viral rhinitis present, it can spread to the mucosa of the sinuses also. Swimming in contaminated water. If there is infected water or contaminated water, if the person swim in that, that can cause acute maxillary sinusitis also. Dental infections. If there is abscess in the teeth or infected teeth, this infection can spread to the maxillary sinus also. Here you can see the abscess in the dental abscess. This infection can very easily spread to the maxillary sinus. And also trauma to sinus as compound fracture. Compound fracture, when there is a fracture of the facial bone, and that is the compound fracture, and there is involvement, or it can comes out of the body, or it invades the skin, then also sinusitis occur as a result of that trauma, especially when it leads to compound fracture, not the simple fracture. So all these are common causes of maxillary sinusitis. Clinical features of maxillary sinusitis are the constitutional symptoms. As with any infection, there is fever is present that can present as the constitutional symptoms. Then we have headache and pain is also present, that can present as sinusitis can present as fever, headache, pain is present. Other feature is tenderness and nasal discharge. Also, we have redness and edema of the cheek. We are talking about the maxillary sinusitis, and this is the site which is usually affected by the inflammation or infection of the maxillary sinus. So it can cause a redness and edema and swelling of the cheek. And lot of times people who have infected teeth. It can cause swelling of the face also because of the spread of the infection to the maxillary sinus. So these are the common clinical features of the maxillary sinusitis: fever, there is headache, pain, tenderness, redness, and swelling of the cheek. Treatment is usually medical treatment is antimicrobial drugs like ampicillin, amoxicillin. So acute maxillary sinusitis treated with antibiotics. Then also nasal decongestant drops can be used. Steam inhalation. This is the steam inhalation. It can also help to relieve the stuffiness and to thin the secretions present so they can drain easily. So steam inhalation is important. Analgesics, painkillers like paracetamol is effective also. Hot fermentation or application of hot to relieve the pain and tenderness and swelling. Surgical treatment is antral lavage. If there is blockage of the maxillary antrum, the opening is closed, then the drainage of the secretion is not possible. To lavage of the antrum, to open up the opening, helps to relieve the conditions. All these are the different treatment options for the treatment of acute maxillary sinusitis. The diagnosis is by the X-rays and trans-illumination test. Complications are the subacute chronic sinusitis. If the sinusitis is not treated properly, it can lead to chronic and subacute sinusitis. Frontal sinusitis, it can spread to different sinuses and it can affect the frontal sinus also, leading to frontal sinusitis. Very typical presentation of the patient. They have stuffiness of the forehead, so they keep their fingers like this, and that's very, very suggestive of frontal sinusitis. Then there is osteitis or osteomyelitis of the maxilla. Maxillary sinus is involved when the infection spread to the bone or the bone marrow. It can cause osteomyelitis or osteitis of the maxilla. Then we have orbital cellulitis or abscess can also occur as a result of the complication. Then acute frontal sinusitis, these are the frontal sinuses, and if they become inflamed, this leads to frontal sinusitis. So inflammation causes swelling of the swelling that blocks of the opening ostia of the sinuses, trapping mucus inside. So if the ostia is blocked, the mucus is trapped inside and cause severe symptoms. The etiology again is follows viral infection mainly, then bacterial invasion, entry of water in sinuses, external trauma to sinus is present, and then we have edema of middle meatus and infection. So frontal sinusitis also occur as a result of viral infection by superimposed bacterial invasion, and then there is entry of water in the sinuses and trauma to sinus and cause edema and infection. So this is the cause of the frontal sinusitis. Clinical features and complications that can occur: frontal headache is common, pressure is common, there is tenderness present in the forehead, edema of upper eyelids. So swelling of the upper eyelids can occur as a result of frontal sinusitis, and there is nasal discharge also associated with frontal sinusitis. So very important feature of frontal sinusitis is the frontal headache and tenderness. Complications include orbital cellulitis, very close frontal sinus is present close to the orbit. So orbital cellulitis is common. Osteomyelitis of frontal bone and fistula formation as a result of infection and destruction of the bone. Osteomyelitis fistula can form, which is the connection or communication between two structures. Meningitis and abscess can also form, and then we can have chronic frontal sinusitis if acute infection is not treated, and if it is persist, it can cause chronic sinusitis. So all these are different complications of frontal sinusitis. Treatment of frontal sinusitis is the medical treatment, which includes again antibiotics, decongestion of sinus ostium, and combination of antihistamine and nasal decongestant. And then we have surgical treatment, which include trephination of frontal sinus if persistence of pain or pyrexia, in which the hole is made in the bone or the skull, and then it is treated, or the drainage can be done. So that's the trephination of frontal sinus. So it can be treated both medically and surgically if the condition persist and cause complications. Next, acute ethmoid sinusitis. This is the area close to the inner canthus, lower portion of the inner canthus, and the eye or the orbit. So this is the pointing when there is ethmoid sinusitis. The etiology is mostly it is due to infection of the other sinuses. Common in infants mainly. Clinical features is the pain, edema of the lids, nasal discharge, and swelling of middle turbinate. So that's the presenting features of ethmoid sinusitis. More common in children, and there is swelling, pain, discharge associated with ethmoid sinusitis. Treatment is of ethmoid. In this picture you can see these are the ethmoid sinuses. Treatment is same as acute maxillary. Usually antimicrobials, antibiotics are used. Then we can use the decongestant drops, and then painkillers if there is pain, and all these sometimes mixed with antihistamine also. So that's the treatment of the ethmoid sinusitis. Visual deterioration and exophthalmos indicate abscess. So if the eyes are involved, there is bulging of the eyeball and there is visual disturbance, that it indicates there is presence of abscess or orbital abscess. Required drainage of ethmoid sinuses. External ethmoidectomy incision. External incision is given, and drainage is done, and ethmoidectomy is the removal of the ethmoid. Complications include orbital cellulitis and abscess, visual disturbance if there is orbital cellulitis and orbital abscess. It can naturally cause visual disturbances, and in severe cases even blindness. Cavernous sinus thrombosis can also occur, and extradural abscess and meningitis. All these are complications of the ethmoid sinusitis. Then acute sphenoid sinusitis. Here, if you see the lateral picture, this is on the back there is sphenoid sinus. This is the sphenoid sinus. So etiology is rare isolated involvement of sphenoid sinus. Sphenoid sinus is mainly affected as a result of infection that spreads from the frontal sinus and the maxillary sinus. Part of pansinusitis associated with infection of posterior ethmoid sinuses. So when posterior ethmoid sinuses are affected, it can spread to sphenoid sinus. Clinical features are headache, post-nasal discharge that is felt at the back in the throat, and also a streak of pus nasopharynx is present. So these are the common features: post-nasal discharge and the pus in the discharge are the signs or clinical features of the sphenoid sinusitis. Diagnosis and treatment is we diagnose by X-ray, which shows opacity and fluid levels in the sinus, and CT scan is also performed. Treatment is the same as for acute infection of other sinuses, which is the antibiotics, antihistamines, decongestant, painkiller, depending on the presentations of the patient and the condition of the patient. So again, this is the frontal view. This is the lateral view of the sinuses. We have frontal sinus, then the ethmoid sinus, sphenoid sinus, and maxillary sinus. These are maxillary sinus, ethmoid sinus, and the frontal sinus, both healthy and inflamed with fluid and secretions present. Mucocele, its neoplasm simulates feature of acute infection. So this was all about the acute sinusitis. Thank you for watching sqadia.com.